Good afternoon. I'm Kevin Brown, serving as the Interim Commissioner of Education for the Commonwealth of Kentucky. I want to welcome all of you today to our Reopening Kentucky Schools, a virtual town hall for educators and staff. This is also a virtual town hall that's open to the public. We want to welcome you to this town hall for this to discuss these very important issues as we contemplate beginning a new school year. If you could go to the next slide, Melody. I just want to give a few reminders, and then I'm going to ask the Lieutenant Governor to provide some opening remarks. This town hall is being archived on the KDE Media Portal, and as I said, it is open to the public. It is also being recorded. The purpose of the town hall is to review the major elements of what we're calling the flagship guidance document produced in partnership with the Department of Public Health called Healthy at School. In addition, we will be going over several other guidance documents. Up to 15 guidance documents related to opening schools amid the pandemic, and we want you all to understand and know where those documents are. So we'll be reviewing where to find those on the KDE website, and most importantly, we're going to be taking questions from you, and you have already done a great job submitting those questions. The portal for the questions, we opened that last night. I think we have over 200 questions already. However, we're only going to be able to address the questions that are related to the state level issues. And then any questions we're not able to address, we will be including those in a Q&A document that we'll talk about later that already exists on the KDE website that talks about COVID-related issues regarding going back to school and all things education. We already have about 500 questions and answers in that document. And again, as a reminder, to participate and ask additional questions during the live event, you can go to the gosoapbox.com address that's on your screen, and the access code is KDE Town Hall. I will now turn it over to Lieutenant Governor and Cabinet Secretary Jacqueline Coleman for some welcoming remarks. Lieutenant Governor.
Thank you so much, Commissioner Brown, and welcome everybody to our Reopening Kentucky Schools Town Hall. We are so happy to have all of you here with us today. We wanted to make sure that we communicated directly with our education community since you guys are where the rubber meets the road. So I'm going to start with just a few pieces of information and introduce some famous folks that you have gotten to know over the course of the Team Kentucky updates. So first, I want to make sure that everyone understands that this conversation has certain limitations because we are not in your individual local school districts. And so we will be sticking to conversations around the flagship document about best practices and safety expectations for our schools. It was created in partnership with the Department of Education and the Department of Public Health. And we're going to steer away from those more localized questions. Those are for your school building leaders or school district leaders. I want to commend the Department of Education for the work it has done from May 15th to July 21st. They have released a litany of guidance documents that cover every subject from evaluating students' academic readiness to supporting staff and student wellness. So they have continued to churn out information based on the best practices out there to try to support the reopening of schools. In addition to that, there are about 20 additional documents that come from other professional organizations like NEA and the Southern Regional Education Board and the CDC, of course, as we need. So just want to make sure everyone is aware that those documents are out there and accessible. I'm sure Commissioner Brown will go over that a little bit more because that work has been remarkably helpful in making sure that we have the best information out there for our folks. So real quickly, I guess, Commissioner Commissioner Brown, we can come back and talk about the flexibilities at whatever point you choose. But I want to go ahead and introduce everyone to someone that they probably feel like they know at this point. Dr. Stephen Stack comes to you live in your living room pretty much every day these days. And with him is Dr. Connie White, who works very closely with the school segment of making sure that we are reopening in the right way. So I will turn it over to you folks. Kevin, I think you're muted.
You're muted, Kevin.
Thank you. Dr. Stack, before we begin with your presentation, that we have a few slides. If we could go to the flagship document slide, Melody. Want everyone to understand that we're calling this our flagship document. This is the document that provides 5 areas of expectations as we go back to school that will increase our safety during a global pandemic. And you'll hear Dr. Stack and Dr. White go into detail about the reasons for these expectations and then what these expectations are. And we call it our Healthy at School flagship document. It's a flagship document because it's a document that leads all the others. We have around 14 to 15 other documents, guidance documents that go into detail about everything from bus safety and protocols to cafeterias and even how to do such things as fire drills during a global pandemic. And you'll hear where to find those documents. But we're going to focus today on this flagship document because this is where you will find the basic and the base level expectations from public health about how we can go back to school and decrease the risk of the spread of COVID-19. And then Melody, could you advance to the next slide, please? Also want to thank our partners at the Jefferson County Public Schools. They assisted us in translating these documents, particularly the Healthy at School document, into the top 5 languages spoken in Kentucky schools. And then also the University of Kentucky provided a translation in Chinese. So we have this document in 6 languages. We also have posters over my left shoulder. You will see a poster, an example of a poster. You may have seen Governor Beshear hold that poster up at a press conference several weeks ago. We have that poster available for school staff to print out in a poster format or stickers or 8.5 by 11 for to put in your schools that remind you of the information you're going to hear about from Dr. Stack today. And we also have that in 3 different age-appropriate versions, one for high school, middle school, and elementary school. So Dr. Stack, with that, I will turn it over to you. And Melody, if you could advance the slide, please.
Well, thank you, Commissioner Brown. I know that Commissioner Brown and I and the Lieutenant Governor get to address you and communicate with you on a regular basis, but yeah, I know you're well aware it takes a large team to try to do all this work. And so on behalf of our teams, let me say thank you. Let me thank Commissioner Brown for his leadership throughout this difficult time. And also Commissioner Kinney, who is his deputy commissioner, and my deputy commissioner, Dr. Connie White, who will stay with you here for the duration once I have to depart for my next engagement. I am here today just to set the context. I know that you have all probably heard me speak in other settings, if not at the press conferences with the governor many days a week. But I think it's important to put this in context. I think we probably can't do this enough because the context is what makes sense out of an otherwise upside down world. So if we can move on to the next slide, I'd like to first kind of describe where we started and how we got where we are. So we face an infectious disease threat unlike any we've seen as a human species for over 100 years. It's a disease that nobody's immune system has been exposed to, and so all of us are vulnerable to it. It didn't exist in people until late 2019, and then it only existed and first existed in China. It affected a city called Wuhan, and that city has about 11 million people. It's in a province, well, actually larger Wuhan, metropolitan Wuhan is about 19 million. It shut the entire city down. So if you think about that, It shut down a metropolitan city that is more than 3 times the size of the entire population of Kentucky. And within 2 months, it had spread from that lockdown city and province in China to the United States. And so we had cases in Seattle and nursing home residents. And we also had, on March 1st, the first test positive patient announced in New York City. Within a couple of months, New York City found its hospitals overrun and found that it had field hospitals set up in Central Park. And it was really an unprecedented public health crisis that New York faced, and they had to take measures that were not exactly the same as China, but were for the United States very dramatic, locking down transportation, closing businesses, and those steps took multiple months before they got the virus under control. And so now New York is in a better shape, but they also have an estimate that perhaps as much as 1% of the total population of New York City has died from COVID-19 as a result of this epidemic. And so just to put that in context. So on March 6th, we had our first test positive patient identified in Kentucky. And on March 13th, and on March 6th, Governor Beshear declared a state of emergency for Kentucky. And 1 week later, the president followed that lead and declared a state of emergency for the nation. And for the first time in the history of the United States of America, all 50 states in the United States of America are currently at the same time under a declared state of emergency. And as I understand it, that's never happened before in our nation's history. The modeling based on the experience in Wuhan, Lombardy, Italy, and northern Italy, which is very sophisticated and wealthy and approximates what it would be like in the United States, and then also in areas like New York, suggested very early on that if the disease were to spread rapidly in an unmitigated fashion throughout Kentucky, we could face 1 to 2% of all Kentuckians dying over the next year or the current year we're in. And to put that into real numbers, that's 45 to 90,000 Kentuckians who could have died from this infection were to spread rapidly through the entire population. Now you can discount that by any number you want. So even if we're off by a factor of 5 or 50% or 2, you'd have staggering numbers of people dying, 22,500 or so, all the way up to 45,000 people dying. It's staggering how many people that would be. There is no vaccine, there is no cure, and there is no effective treatment specific for this disease. Now, there are treatments that are showing some promise, remdesivir being one of them, and then other long existing treatments like steroids and other interventions, which have shown some potential benefit, but those benefits are really only for people who are hospitalized. We don't have any treatment to offer someone who goes to a clinic, gets a test that's positive, and say, here, take this medication, like we might give you penicillin for a strep throat. We don't have any intervention that will address that. So until further notice, we have to make do with the tools we have, which leads to the next slides. And if I could see the next one, please. So these are traditional public health interventions that we can take to impact this virus. Social distancing, in an extreme sense, if we all stayed in the room and never left, we would have the infection would go away very quickly because we'd never come in contact with each other, and then we would therefore never spread the infection to anyone else, and so it would quickly disappear. That's not practical. It's not consistent with life as we know it, and so it's not going to happen. But what we can do is say that people should keep a sufficient distance between themselves to minimize the risk of sharing infection with each other. Now, I don't know if I have it in here. I've forgotten, but we spread this infection primarily from the secretions in our mouth, our nose. When we talk or cough or sneeze, we spray secretions in the air. You've all seen this. Those secretions can spread a substantial distance. Old studies showed maybe 3 feet, and then there was some increased margin there, and CDC picked 6 feet. More recent modeling has shown that a typical cough could project secretions 8 feet or more into the air, so it's actually even a greater distance. So we rely on the CDC's guidelines, which are a 6-foot distance between people, to try to reduce the spread of infection from person to person. Cloth face coverings. Earlier in this journey, it was not clear how much those would be helpful. There's been a lot of study on that now, and a lot of evidence has been mounting to show that if we wear a simple cloth face covering over our face, we can substantially reduce the spread of infection from me, if I have infection, to someone else who may not be infected. To a lesser extent, they may also help keep someone else's secretions from getting to you. That's not the primary benefit of it, but it is a benefit on some level. So cloth face coverings are really, really important, because that single measure alone, the federal government has said if 80 to 90% of people follow that could effectively contain the virus and keep it under control well enough for us to get back to most of our activities. Screening and temperature checks are important. I know each one of these offers their own challenges, but this is really important because we know that, 20 to 40% of people may not have any symptoms. For the people who have symptoms, they have a handful of symptoms commonly, fever being one of the more common ones. So if a third of people with infection develop fever, that's the low-hanging fruit. If we don't look for it, then we have missed the easy stuff we can catch. It's the third that may not show symptoms that are much harder to contain before they spread infection. Hand and surface hygiene are very important. I don't think we all paid attention to much before this pandemic, but maybe we do now. How often we touch our face, our eyes, our nose, our mouth, the things we put in and out of our mouth, chew on a pencil, some people put the edge of their temple from their glasses in their mouth. Things like that are all opportunities to deposit the virus onto a surface, and if other people touch that surface, they can get the infection. This is not the predominant way this infection spreads, but in the school setting, if you have a student sitting in front of a desk for an hour and coughing and sneezing and rubbing their nose and touching the desk, and if you place another student there right after them and you haven't wiped that surface, there's a very good chance there could be virus deposited in sufficient quantity on that surface that another student rubbing their hands on the desk and then touching their face could potentially infect themselves. So that hand and surface hygiene is important. Even if it's not the primary route of transmission, it is something we can address by enhancing our hygiene. And then contact tracing, which is important. I'll come back to that in just a minute. And I'll go more quickly through these other slides. If we go to the next one, please. Each of these slides is just about the details. I've already talked about why social distancing is important, but you'll have access to this slide to remind you. 6 feet is the distance that's recommended by the CDC for most settings. Cloth face coverings help keep the infection to ourselves, and whenever you cannot be more than 6 feet away from someone else who you don't live with in the same household, you should wear a cloth face covering. You should not get medical grade masks unless you are providing medical services. For almost every setting, it is not necessary for you to have medical grade masks, and certainly not N95s. We still have a hard time getting enough of those for the hospital settings and the doctor's offices, so please don't try for routine activities. The next slide, please. I talked about, I think this is, the temperature checks and screening. And again, I rattled off some of these statistics, but for the 2/3 or so that do have symptoms, measuring a temperature is one of the easiest, most objective things we can do. If someone has a fever, they should not be permitted to go into mixed company with other people, because that is low-hanging fruit. Those are individuals we know already are likely to have infection, and by letting them expose themselves to others, we miss the easy step of catching the low-hanging fruit and minimizing the spread of infection. This would hold true even without COVID-19, but for most of the other infections, the consequences is not as substantial. For COVID-19, it is. Hand and surface hygiene, I've already talked about. The most important thing you can do, all of us, even in hospitals, if there was one single thing that people should do to minimize the spread of hospital infection, it's wash your hands. And when you can't wash them, sanitize them with alcohol-based sanitizers. So that's also very important. Next slide, please. Contact tracing is not a concept most of us are familiar with because we've not had to be exposed to it. But this is a long-standing, I don't know how long, but I know they used it in the Spanish influenza in 1918, and so it's well over a century old, and it's probably quite longer than that. When you identify someone who has infection, you find the people they immediately came in contact with, you isolate the infected person, and then you isolate the people who they have directly exposed, and by doing that, you essentially minimize and ideally prevent entirely the spread of infection to multiple people in a chain. If you keep the disease under control enough, very few people are affected by this, and you keep the disease tightly controlled, and then it never takes off, it never becomes a widespread problem. Right now, we have a widespread problem because people didn't wear masks, because people didn't socially distance, because people went out and returned to life as they used to know it. We are now seeing increases in cases in Kentucky, and certain other states are having their hospitals get filled up and are going to go through some very, very painful times here in the next coming weeks. We don't want to have that happen in Kentucky. We want to get students back to school, adults back to work, and people back to the things they enjoy doing socially. The ways we do that are through these other activities, principally social distancing and mask wearing. But if we get things under control again, this contact tracing is how we minimize all those other impacts, because if we identify the people with infection and the people they may have infected quickly and have them isolate themselves, we can shut this thing down effectively. But it requires training all of society to these new norms and the things we need to do. In the next slide, please. I don't think there's too much more here. I think we're almost done. Is there one more slide, Melody?
Yes, it should be showing.
There we go. Thank you. And so this sums up what I've already said. I know these things are disruptive. I know they're inconvenient. Collectively, I'm sorry for all of us that we find ourselves here, but the virus doesn't care about our personal beliefs. It doesn't care about our race, our ethnicity, our religion, our ideologies. It doesn't care about any of that. It doesn't care what city, county, state, or nation we live in. This virus went over 7,000 miles from China to New York in 2 months, and it was in Kentucky 5 days later, when we found it, another 375 miles from New York City. It spreads rapidly. We still probably have no more than 5% of Kentuckians who've been exposed to it or infected by it, which means fundamentally the entire Kentucky population is still susceptible. There is no vaccine, cure, or treatment. And there will be no vaccine until next year at the earliest. So until then, we have got to find a new normal. And the primary document that Commissioner Brown and my Deputy Commissioner, Dr. White, and others, Lieutenant Governor, will go over with you and answer questions. Those are the things we can do. As inconvenient as they are less inconvenient than not having our students attend school and not having the many other benefits that go along with school that are tied to it. And I'll let others who deal with those aspects address that. I think this was my last slide. I do want to make one other comment. There were a number of questions that were shared. There's one Dr. White thought it would be good if I addressed. The new order that just went out, I believe here on July 20th, for gatherings up to 10, that does not apply to the school setting. So it's in the order, it says that these orders don't apply when there's other healthy at work guidance that specifically addresses your situation or setting. So the restriction of gatherings up to 10 is for when we informally get together. It's the family gathering in the backyard. It's the neighborhood barbecue. It's the informal family reunion at the state park. Those are not professionally organized. When you have a place of business, an official, a venue or an event space, so you're talking about a hotel organizing an event like a wedding, or you have a school that is conducting educational activities or activities related to school, their athletics, they should follow the other healthy at work guidelines, and the guidance up to 10 does not apply. Now, this is a distinction from and different from when we started this process in March, because when we started it in March, we didn't have all of these setting-specific guidances, and we are trying to be as narrowly refined as we possibly can to let as many activities get back to their activities as normally as possible. And so the generic gatherings up to 10 restriction is for informal organized activities, not structured activities like a school or an educational district would implement. Commissioner Brown, thank you for the privilege to be here. If you have any questions of me, I'm happy to address those, but I know you have a lot on the agenda, and Dr. White will stay with you for the duration.
Thank you, Dr. Stack. Karen, do we want to have a few questions, about 5 minutes of questions related to this topic, and then move on, or do you want to move on now?
It's up to you. What I would point out.
Let's have about 5 minutes of questions, and Dr. Stack may be able to stay with us a few minutes longer, and then we'll move on to the next one.
Okay. Let me just point out that I have gone through these ahead of time, and there were so many that were similar, so you may not hear exactly your question or the way that you worded it, but to get through as many of these as possible, I've kind of made these into some generic questions. So the first one is, how are we protecting preschool and kindergarten teachers at public schools across the state, given that masks are not required?
Right, and I'm going to observe here as we start. I have Dr. Meserly here too. I didn't see her in the gallery, but there were a number of people. So Dr. Emily Meserly and Dr. Connie White have been my two colleagues. Dr. Meserly leads our immunization branch, so she does a lot of activities that pertain to children. Let me ask Dr. White or Dr. Meserly, who's going to take that question for us? You're on mute, Connie.
Dr. Meserly is the former school nurse, so
Yes.
I'll let her take that one.
Yes. Hi, thank you so much for having me today, and I appreciate our collaboration with Commissioner Brown and his team. So I've had that question a lot, and I've been working also with the Sarah Vanover and her council on childcare. So in order, the most important thing to protect children who are not wearing masks is hand washing and hand hygiene. That will in turn protect their staff, the staff members. But adult staff members who are working with kindergarten age and preschool age children, those staff members need to be wearing a mask. That is very important that they wear a mask, and it's no different than the child care setting recommendations that we have.
Okay. Can you please provide some further guidance on the 6-foot circle desk arrangement? This appears to allow for the most students in a space, but can you give a little bit more guidance? Is it a 6-foot diameter, radius, or 6 feet between each student to the left and to the right?
I think we were looking at a 6 feet diameter. So because if you think of why the 6 feet is happening, it's because of those respiratory droplets being spread. So you want to be able to look forward and talk. You want to look to each side and talk. And so I think you want to put that diameter around those students so that they're not spreading to each other.
Okay. I'm seeing a couple that are probably more for our folks. I'm going to try to stick with the ones that pertain to you. We have been told, according to the health department protocol, one is considered to have been exposed if they are within 6 feet of a confirmed case for a period of 15 minutes at a time or longer. Based on that, if we practice social distancing and wear a mask when we can't social distance, we would not be considered to have been exposed, and we would not have to be quarantined. Is this accurate?
Yes and no. Contact tracing is very individual. So that's why we have contact tracers that have been trained on how to do this. And so they will talk to every exposed person and get a little bit more of a story from them. So you have either a low risk exposure or a high risk exposure. So if indeed you were in a classroom, you were not close to that student, you had your mask on, they had their mask on, you would be considered at low risk. If I'm sitting here at my desk and somebody down the hall is positive for COVID-19 and I've passed them intermittently, I would not need to be quarantined for that. But if you're close to that person, there's not good use of the mask. If I'm doing something with them, if I'm eating with them, and of course you got to take your mask off if you're eating, and you're too close to them at that period of time, then that's going to kick you from the low risk exposure to the high risk exposure. That high risk exposure would lead to quarantine.
All right. In light of the recent surge, or in the event of a future surge, will guidance become more restrictive, such as online learning, in order to ensure the safety of all those who work in schools?
So I'll jump in on this one. So this is a challenge. We would like to be as precise as we can, but precision may be setting specific, like schools versus a factory versus a bar versus a restaurant. But it's very difficult to be specific just city to city or county to county because people move across those artificial boundaries. And so that's a lot more difficult. And we even have, obviously, sometimes employees who travel across counties and stuff. So if you have nearby counties that have a problem and yours doesn't, those kind of refined restrictions are difficult because they're map-based distinctions. They're not necessarily consistent with how the disease spreads. So I think it is going to continue for the foreseeable future to require individual districts and superintendents to partner with their local health department, and then also to follow the overarching guidance we're getting from the state to try to do the best we can to get as normal an educational experience as possible, and then take action that's unique at the community level or at the school district level. That is very frustrating to a lot of people. I respect that. But I also have committed to people to not try to convey a false level of certainty and precision when I can't. And so as nice as it would be to say, well, hey, we have a map with a red light, a green light, a yellow light, and you do this behavior based on your stoplight color, I think that we could definitely create things like that, but I don't think it would be accurate. I don't think it'd be reliable, and I don't think it's consistent with our current understanding and ability to refine our interventions. So if we ever find a way to do that, believe me, we would like to find a credible way to do it. I haven't seen anything credible that I believe is better than people using their educated judgment based on their knowledge of the community and using the best available evidence that we can provide from the state level department, and then from the various other agencies.
And Karen, can I go back and make one comment about the earlier question? One thing that you're going to be asked to do if you are a teacher is to keep manifest, and that's going to seem very annoying. Where did everybody sit at lunch? Where does everybody sit in the classroom? Where is everybody sitting on the bus? The reason for that information is for the earlier question. If I'm sitting on the bus and I'm in the front 3 rows and some child, the student on the back row is positive, that's going to help the contact tracer know better your risk level. So just as Dr. Stack was saying, we can't give a one answer for Connie County. We can't give an answer for, I rode on the bus with a student that's COVID positive. That doesn't necessarily mean you're at high risk. You have to look at things so very individually on such a local level. So the manifest will help to keep your whole school from being closed down, because the contact tracers can come in and very surgically determine who's your high risk, who needs to be quarantined for the next 14 days while everyone else can go on with their learning experience.
That's very helpful. My process brain kicks into gear, and I'm like creating seating charts for everybody that I check off every day. Another question, is it truly safe for a class to have 30 to 32 students that close to each other, even if they're wearing masks?
How close? You got cut out there. How many feet did you say?
They didn't say. It just says, is it truly safe to have 30 to 32 students that close, even if they're wearing masks? So I'm assuming an average classroom size.
So I'm going to give an overarching answer, and then Connie or Emily will clean up my answer. And I will probably have to exit then because I have to start getting ready for the governor's press conference. But but this is why I think it's worth having me in my role as commissioner answer that as the start. We all have to get in our shared understanding. There is no absolute in this. We cannot guarantee safety. We can reduce risk, and we can reduce risk effectively, and we can reduce risk substantially, or let's use a different word, a lot. We can reduce risk a lot if we do these things, but there is no absolute. So we all have to understand we're trying to balance what is a level of risk reduction that may be necessary and beneficial with what is either insufficient or what is overkill. And different people have different opinions, but the science is pretty good on some of this. So the science is exceptional that if you can have people wear masks and they're keeping their secretions to themselves, that single thing alone is of enormous importance and value in reducing risk. The science is also very, very solid and compelling that the more distance you have between someone with infection and someone without infection, the less likely there is to be a transmission of infection from the one person to the other. Now, there's different numbers out there. World Health Organization uses 1 meter, which is about 3 feet. CDC uses 6 feet. Different professional associations in other areas have recently said, oh, you can put kids 3 feet together. And then people will be frustrated and say, well, why not in Kentucky? Why won't we just say 3 feet's okay? Well, there, if you look at my Twitter feed, and I'll tell you, at Stephen Stack MD on my Twitter feed, there's a video I posted within the last few days where someone simulated with a mannequin a cough or a sneeze and showed how far the secretion sprayed. Even with a cloth bandana on your face with a mannequin-produced cough, it was 3 feet 7 inches. That's with a bandana over your face. It was over 8 feet with nothing in your face. And someone will say, well, then why don't you make it 8 feet? Well, I would just say to the schools, how easy is it to make it 6 feet, right? And, well, why don't you make it 3? Well, 3 is a lot less safe than 6. I mean, there's no doubt about that. So people make risk trade-offs, right, for what risk we're willing to take. I think if you're sitting 3 feet apart from each other in the classroom with a whole school, 24 kids, you have a substantial risk because it is so close, particularly if you're not wearing face coverings. If you're wearing face coverings and if you have a room that's so small that you still have to have them 3 feet together, now other modes of transmission, which are not as prominent, but which are still not clearly defined, which would be aerosol transmission. Now, this is when microscopic particles suspend in the air and the virus stays for a lingering time. That's why contact duration is important. So 15 minutes or more in close proximity to someone with infection is considered high risk. If you had 3 kids in a room with infection and you didn't know it, and they all sat in that room for an hour breathing in and out air, there's a good chance that could become, in the right setting, a risk of infection. So all of it is risk reduction. I don't want anyone to be terrified to go to work or anyone terrified to go to school. We're trying to balance what we think will reasonably reduce the risk and keep the vast majority of people as safe as we can. In 6 feet in a face covering, or if you are 6 feet apart and you're static, you're not walking around the room, you can take your face covering off. I believe that's in the guidance. We have attempted to do the best we can to allow for those permutations that we think exceed the 80-20 rule. But there is no 100% because the 100% means none of us get to do anything until this is over, and that's clearly not going to happen. I'm sorry I have to drop. Thank you for letting me into. And thank you, Commissioner Brown. Thank you for letting me into your living rooms every day, those who are watching this. It's certainly not what I thought I signed up for when I became a health commissioner, but it's been a privilege to serve you. And good luck, everyone. Like the governor says, we'll get through this. We'll get through this together. So thank you very much, everyone.
Thank you, Dr. Stack. Very helpful. And to those watching, we will have the last part of the town hall. We will is fully dedicated to questions and answers, and we will have more questions that will generate responses from public health. We have Dr. Meserly and Dr. White here. But before we get to the full question and answer, we have a few more areas we want to cover. Next, we have Dr. Kelly Foster, and she's going to give us a brief overview of the KDE, the Kentucky Department of Education guidance documents, and other COVID-19 related guidance documents from other organizations. We're not going to go over all of the contents of these documents, but we want you as teachers, school staff, members of the public, we want you to know where these documents are located on the department website, and so that you can easily locate those. I think if we did a town hall to go over all the documents in detail, we'd probably have a 3-day town hall. That's how much information is there. But we want to make sure you know where the documents are, the general titles and subject matters of the documents. So, Dr. Foster?
Thank you, Commissioner. Good afternoon, everyone. Welcome to the webcast. I think this is a very unique experience to have all of the teachers across the state joining us this afternoon. And what I'm going to do is I'm going to turn my camera off and walk you through some screenshots of the web page and talk to you a little bit about the guidance that we have been releasing since May. Next slide, please. If you go to the KDE webpage, that's what you see on the left-hand side of your screen there. and you will see a blue link that says KDE COVID-19 webpage. If you click on that link, it will take you to the KDE COVID-19 webpage, which you see on the right-hand side of the slide. And the area that I want to bring to your attention is the green area at the bottom, and it talks about reopening schools. There are two sections there. There is the KDE reopening guidance and the non-KDE resources. And so each week on Mondays, we have been releasing different guidance documents and then highlighting those on Tuesdays with our superintendents. And then, for example, we have been also posting guidance from SREB, from the Kentucky High School Athletic Association, the CDC, and you will find those additional resources under the non-KDE resources link. Next slide, please. Okay, so this just brings it a little bit easier for you to see those two areas, KDE reopening guidance and the non-KDE resources. And as I mentioned before, we have been releasing guidance every Monday since May 15th. And to date, we have released 16 guidance documents. And one of those guidance documents is the flagship document that Kevin referenced earlier in the webcast. And that's what we work jointly on with Public Health. And so if you have not seen that document yet, I highly encourage you to review that, because it will really help you as a building level administrator or a classroom teacher feel more comfortable with what's in that document. Okay, next slide. Okay, I'm not going to read all these to you, but you will have access to this PowerPoint. You may have so already, but you can see each week this slide and the next slide will talk to you about the guidance documents. And if you look at June 24th, that's the one that we collaborated with Public Health on. It's the Healthy at Schools document that you want to spend some time looking at. And the other documents, there's information here on how to set up your classroom, how to sanitize your classroom, how students are going to need to board the bus. We're going to load the bus from the back to the front. There's information on class changes and hallway information, how to organize your children in the lunchroom. So each one of these documents will provide additional help for you. Just this past week, we released 3 guidance documents on Monday, and one of those deals with participation, and David Cook is going to talk a little bit about that later on in the webcast. And then Greta Hilton's office that deals with exceptional children, they released some guidance on Monday. So if you work with special needs children, the exceptional learners and preschool students document was released on Monday, so you'll definitely want to check it out. Okay, next slide, please. So there's definitely a lot of information in the guidance documents, but I would encourage maybe your grade level PLC to split those documents up, and so everyone's not having to read all 16, or school leadership teams assigning documents to specific grade levels. But the information in there has come from the experts throughout KDE in specific areas, as well as guidance from Public Health. So I think if you take some time and go through those documents, you may have a better understanding of what your classroom needs to look like during reopening. Thank you.
Thank you, Dr. Foster. I strongly encourage everyone, please go to that website and look over those documents. Also, members of the public, starting with that flagship document that we referenced that was issued on June 24th. As I said, that is the document that leads all the others. So, for example, you may see just a few bullet points in the flagship document about what are the expectations for sanitation on a school bus. And you may say, well, there's more to that than 3 bullet points. Well, those are just the expectations. You'll see another guidance document that goes into very fine detail about pupil transportation. And so that's why we have 16 of these documents. The one leading it is the public health expectations. Those those main points that Dr. Stack went over: the social distancing, cloth face covering, screening and school exclusion, sanitation, and contact tracing. Those are the areas that are leading us right now. And those are the areas that we highlight in that guidance, the flagship document, and then all the other 15 documents go into great detail about how to implement those on a district, school level, and classroom level. The next item we want to talk about is flexibility.
Kevin, can I make one statement real quick?
Yes,
just
sure.
in case just in case the teachers haven't seen the document before, the flagship document. It's divided into 2 sections, and it talks about safety expectations and best practices. And so, just to know that the safety expectations are the items that public health say that needs to happen for sure in your classroom and in your school, and the best practices are other areas that you may want to look into, but that are not required on a daily basis at your school. So just know the difference in those 2 areas. The document explains that, but there is a big difference between safety expectation and best practice. Thank you.
Thank you, Dr. Foster. And another thing, too, that we should be reminded of, and you've heard the governor talk about this when he's talking about the healthy at work guidance, and he's talked about how employers need to check that document and those documents frequently, because as the pandemic has changed over time, sometimes the guidance changes. And so that's the case. These are living, working, breathing documents. And as we go into the school year, and as we are hearing feedback from schools, additional information from public health, from the governor's office, lieutenant governor's office, and the cabinet, some of this guidance could change. And so we will obviously update the school community when a document changes and make a note on there when it changed and what changed. But please, you will need to reflect and look at these documents all throughout the year as a reference point. Next, we're going to talk about flexibility and waivers that we have been able to issue. Some of that due to the waiver flexibility afforded to the State Board of Education by the legislature. Others due to flexibility that we enabled us to offer some waivers based on the governor's original executive order as implemented by the lieutenant governor, who is also the cabinet secretary. Todd Allen's our general counsel. He's going to go into some detail about those flexibilities, because the flexibilities affect you as a staff member on a daily basis into what we can and can't do because of COVID. But before that, I'm going to ask the lieutenant governor to talk in some general terms about the flexibility at the state level. Lieutenant Governor?
Yeah, thank you so much, Commissioner Brown. So Todd will handle explaining the legal logistics to all of you, because he's very, very good at that. But what I would like to do is make sure that everyone understands the flexibilities that we focused on and why, from a teacher perspective or from an educator, school leader perspective. So the first flexibility that we extended through an executive waiver was unlimited Nti Days. We did that because if there were school districts who some of them already have, and some of you might, decided to go to full-on distance learning, this would allow you to be able to plan that for the foreseeable future. So by extending unlimited Nti Days, that helps you to be able to have more access to digital learning days as you need them. The second waiver that we put into place was we wanted to remove the barrier of the daily average attendance. And so the important point about that is that you all know that our school funding is tied to attendance. And so if we ran into a situation where one district, a district out there wanted to create a hybrid model. I've heard of a lot of districts who are thinking about going to an A-B schedule. So some kids come to school on Monday, another group of kids come on Tuesday, on and on. We didn't want that to count against your school and cost you funding, because the way that we calculate that is the number of bodies and seats. And so we basically allowed districts to be able to utilize the past year or 2 years of attendance data for funding purposes. So this frees up the opportunity for your school district to plan any kind of hybrid model that you would want to implement. And finally, just yesterday, I announced that the department has put forth a waiver that will extend an unlimited amount of COVID-related emergency days to school districts. And what we've gotten a lot of feedback on from you all, and what I would be concerned about if I was in the classroom or an assistant principal still, is what am I going to do if we have in-person classes or a hybrid model, I'm around students, and I am expected to quarantine until I get COVID test results back. It's not fair to you to utilize the sick days that you have earned for that purpose. And so we are now allowing our school districts to extend those emergency days as needed for quarantine-related purposes. So that will help alleviate that burden on teachers who are concerned about coming to school if you do return to in-person classes, and potentially being exposed and then having to utilize the sick days that you have earned for that purpose. So those are the flexibilities that we have allowed, and I am trying to give it to you from a classroom perspective, because that's how we try to think about these things, because like I said at the beginning, y'all are where the rubber meets the road. So that being said, Todd will do a much more eloquent job of explaining the legal logistics behind this. So I will turn it back over to Todd.
Thank you, Lieutenant Governor. I think you did an excellent job, and thank you, Commissioner. So Melody has brought up the slides that I have listed here, and the very first slide that I have for review, it's a very simple graphic. If you'll go to the next slide, Melody, but it is designed to give an overview to everyone, school teachers, district administrators, and community members of how the laws, regulations, and rules that govern our public schools come down to us. So you'll see the top two boxes on the left-hand side of the screen talk about federal statutes and federal regulations. Those are obviously passed by Congress and then federal agencies in D.C. For the governance of schools throughout the nation. And we are required to comply with those. You'll also see in the top box on the right-hand side of the screen, state statute that is passed by our state General Assembly for the governance of schools within the Commonwealth. Our State Board of Education then takes all of those statutes and regulations, federal regulations, and develops their own regulations for the governance of schools. And these are really the state level policies that govern the way our public schools operate throughout the Commonwealth as a whole. The Kentucky Department of Education wraps all of that information together: federal statute, state statute, federal regulation, and then regulation promulgated by the State Board of Education, and provides technical assistance and guidance to school districts throughout the state that sets forth the guidance and expectations for how we operate our public schools. Teachers, school administrators, parents, community members have questions about how all of these statutes and regulations come together for the operation of their local school districts, and it's the department's job to provide guidance and technical assistance related to that. Earlier, you heard Dr. Foster talk about the substantial amount of guidance that the department has issued to school districts so far related to COVID-19. Then with those administrative regulations, federal statutes, state statutes, and guidance that the department has issued, it goes to the local district level for their development of local district policy, as well as to the school level for school level policy that's created by the school council, and as well as administrators that are in the building. The really good thing to note is that based on this graphic, individuals and groups that are responsible for making all of these regulations, statutes, and policies understand that we are all operating in an emergency situation, and they understand the need for flexibility given the situation that we unfortunately find ourselves in with COVID-19. So, for example, federal statute and federal regulation last semester were waived related to state assessments under the Every Student Succeeds Act. Because state statute also provides for state assessments, there was flexibility granted by the Kentucky General Assembly there as well. Our state General Assembly passed Senate Bill 177 that you may have heard about, that provided a lot of flexibility to school districts for the 2019-2020 school year. Of course, I believe at that point in time, we thought that we would be beyond COVID-19 whenever we started school for the 2021 school year, but unfortunately, we continue to find ourselves in a state of emergency. So, through action that both by the State Board of Education, through action by these federal entities that have provided some relief through waivers, as well as action through the State General Assembly that has provided the governor with some authority to take action in the state of emergency, we have been able to provide flexibility to school districts based on feedback that we have heard from districts, from parents, and from teachers. Melody, if you'll advance to the next slide.
Are you able to see it yet?
Not yet.
Okay.
As we wait for that, I'll go ahead. There it is. I'll go ahead and kick it off that this information is provided here just as a high-level overview of the flexibility that's been granted so far. It's in no particular order, and I'll cover it at a high level. First of all, waiver that was granted regarding physical restraint and seclusion for core team simulated experience training. Many of you may be part of your core team within your school buildings for providing restraint and seclusion within your school district, and you may be used to annual training. That training, however, is a hands-on training that requires a simulation of a physical restraint. And given the situation that we're understanding that some school districts may not be coming back to in-person services at the beginning of the school year, the State Board of Education granted a waiver for that so long as an individual was trained since January 1 of 2019. They do not have to undergo the annual simulated retraining for the 2021 school year. Below that, you'll see some waivers related to child nutrition programs. These waivers were provided to us by the United States Department of Agriculture, which is over your school lunch programs and child nutrition programs in your school. If you work in any of the child nutrition programs in your school, you know that these regulations are typically very detailed. They're very prescriptive. So the U.S. Department of Agriculture has understood that we're operating in different circumstances for the upcoming school year and have granted some flexibility that then the department can grant to school districts upon their request. So the requirement for high schools to participate in the Offer versus Serve program, which allows students to select items that they would prefer to eat to reduce food waste, that is waived for the upcoming school year, and that will allow school districts to prepare and provide prepackaged meals instead of allowing students to choose what they want to eat. And that is understanding that moving through the cafeteria line, moving through lunch is likely to look very different this school year than it did before. And there's also a waiver that allows for parents or guardians to pick up meals for their children. It doesn't have to actually be distributed to the child who is eligible for one of those meals. State agencies as well as school districts have to have a plan in place for ensuring that that will be maintained with accountability and integrity if they choose to do that. Typically, the U.S. Department of Agriculture regulations have very prescriptive meal times when school meals may be served, but they have granted some flexibility on those meal times so long as a school district requests that flexibility. There's also a waiver from non-congregate meals. The typical regulations require that school meals be served in a congregate setting or in a group setting, but understanding the need to socially distance and separate students for the upcoming school year, there is a waiver for that as well. And finally, the meal pattern requirements that typically apply have been waived so long as a school district submits a plan to the department. Again, that is to allow some flexibility in providing a grab-and-go type meal or understanding that a meal may need to be served outside of the typical cafeteria setting, and moving through a cafeteria line to try to obtain that meal is going to look very different for the upcoming school year. The next item that you'll see in the chart is a funding relief mechanism for local area vocational education centers. We call those LAVEX. And as the Lieutenant Governor mentioned in her comments to begin, there was some flexibility that was granted to all school districts regarding the way funding flows to those school districts. That was initially provided by the General Assembly with Senate Bill 177 that applied to the last school year, but understanding the need for very different operations, for hybrid operations, and decoupling our funding structure from our in-seat, in-person attendance model, we also determined that it was necessary to provide some funding relief for our LAVEX. So this allows for them to receive their June 30th funding allocation for the entire 2021 school year, and they won't be subject to an adjustment. In typical years, if their attendance had fallen off, then their funding would decrease, but trying to keep that consistent with the way we're providing funding for the upcoming school year to school districts, there's a waiver granted by the State Board of Education there. In the bottom row, on the slide that you see, deals with non-traditional instruction days. The Lieutenant Governor alluded to this earlier, that state statute limits non-traditional instruction days to 10 days. And many of you, whether you're a teacher, a classified school member, a parent in your community, you're probably familiar with non-traditional instruction days that were used historically, usually in the event of snow or some other weather-related emergency when we couldn't get to school. However, as you know, at the end of the last school year, we relied upon and utilized non-traditional instruction days to continue providing instruction to our students when our school buildings were closed. That was initially granted for the last school year based on relief from the General Assembly under Senate Bill 177. But of course, as I've mentioned before, that expired at the end of the last school year. So recognizing the need for continued options for non-traditional instruction beyond 10 days, we were able to rely on an executive order issued by the governor and an emergency regulation promulgated by the State Board of Education that is in place now and grants the Commissioner of Education the authority to grant an unlimited number of Nti Days to school districts for the upcoming school year. So therefore, if buildings are required to close as a result of COVID-19, if school districts are operating hybrid models, where they have some students in attendance some days, some students coming in person other days, this unlimited Nti Day waiver provides the flexibility that we heard from those school districts and education partners that they need. Next slide, please. Okay, so the very top row that you see on this slide deals with in-person attendance and what is called the SEEK funding. That stands for Support Education Excellence in Kentucky funding. Our funding in Kentucky to school districts, that is state funding that's provided to school districts for operation of schools, has for many years been tied to what we call average daily attendance. So if you're working in a school district, you know that keeping attendance is very important. It's not only important for tracking where your students are, but it's also used to fund your school districts. Recognizing that some students may be hesitant to return to school, and school districts want to provide those families with an option to attend virtually even when in-person classes are occurring. Recognizing that some school districts may want to operate a hybrid model where some students are attending virtually on some days and some are actually in person other days, and recognizing that some school districts may operate NTI for a more extended period of time, we recognize the need to decouple that average daily in-seat, in-person attendance from the funding that flows to our school districts. Without this, our school districts may be faced with a very dire situation of not receiving the funding they need to operate for the upcoming school year. This type of flexibility was granted, as others I've mentioned, by the General Assembly with Senate Bill 177 for the past school year, and we heard overwhelmingly from school districts and education partners that it was needed for the upcoming school year as well. So once again, relying upon the governor's executive order, as well as an emergency administrative regulation by the Kentucky Board of Education, we have carried forward the same funding mechanism that was set forth in Senate Bill 177. For the previous school year, that is 1920, school districts chose the data that they would use, whether it was the 1819 school year or the 1920 school year, to determine their funding for the last school year. And that same mechanism will be carried forward for the 2021 school year. So if a school district chose that it's going to use 1819 attendance data for its funding for last school year, that will be carried forward for the upcoming school year. That allows school districts to budget and to plan for the funds that they will receive, so they have some sense of understanding of the funding that they will have to operate their school district for the upcoming school year. In the next row on the chart that you have before you is emergency leave days, which the lieutenant governor previously described as well. State statute currently, or prior to this temporary suspension, limited emergency leave days for school staff to 3 days. That is, local school districts were unable to grant more than 3 emergency days per school year to their school staff. In Senate Bill 177, the General Assembly expanded that and granted school districts the authority to grant additional emergency leave days to their district staff, both certified and classified. And in examining the need for the potential emergency days that exists in school districts, we looked at a variety of measures. We looked at federal legislation that has been passed under the Families First Coronavirus Response Act that provided some leave to individuals as a result of COVID-19. We also looked at other forms of leave that are provided to school district employees in statute and determined that it was necessary, based on the feedback that we received, to grant this flexibility to school districts so that they could provide additional emergency leave to their employees if they elect to do so. The lieutenant governor mentioned, obviously, the potential need to quarantine, and that need could extend multiple times. We could have individuals in our school districts, working in our school districts, who need to quarantine more than once, and we certainly don't want individuals working in school districts who are subject to quarantine or who are ill as a result of COVID-19 being compelled to return to their school buildings and potentially infect other individuals with the virus. So right now, the commissioner issued a memorandum temporarily suspending state statute that limited the number of emergency days to 3, and currently pending before the State Board of Education is an emergency administrative regulation. If they approve that emergency administrative regulation, then school districts will have the flexibility to grant additional emergency days to their employees. The next row in the slide that you have before you relates to assessment for admissions to an educator preparation program. This is for those individuals who are seeking to become teachers. Administrative regulations by the Education Professional Standards Board set the Praxis Core Academic Skills for Educators, or CASE assessment, for admission to an approved undergraduate initial certification educator prep program. While the CASE assessment will still be required, the Education Professional Standards Board has granted some flexibility for the fall of 2020 to push taking that examination further into the future. So it allows individuals who are in educator prep programs to continue forward in those programs without taking the CASE assessment at this point in time, but it will be required at a later date. Next slide, please. So I have for you here a few pieces of pending waivers that we anticipate will be taken up by the State Board of Education at their next regular meeting in August. These are related to state-funded preschool programs. And I'll walk through those just very quickly. The first section that we would anticipate waiver on are the program operation standards and schedules for preschool programs. They are set forth in statute as either 4 or 5 days a week. However, school districts can always and have been able to request historically a change in that. Given the COVID-19 state of emergency that we find ourselves in, we anticipate a lot of school districts needing that flexibility. So versus having each of them make a request, we are recommending to the State Board of Education that they grant a waiver to that provision of the regulation that just grants flexibility to all school districts for their preschool schedules without making a specific request to the State Board. The next section related to preschool requires school districts to provide parents with specific opportunities to participate in the classroom as volunteers. We understand for the upcoming school year that may not be practical or feasible given the need for social distancing. And so we have, although very valuable to have parent participation in the classroom, we are granting or recommending that the State Board grant a waiver to that provision of the regulation. The next section requires at least 2 home visits per child each year who are in the preschool program. Once again, based on the spread of COVID-19 in various communities, the unknown that we're facing right now with how that virus will progress within communities, it may not be safe in certain situations for a preschool teacher to be going into various homes, home to home. I believe Dr. Stack has called that the honeybee effect previously on his press conferences. So we are recommending a temporary waiver of that requirement. The State Board previously granted that for the last school year as well. The next section of preschool that we are recommending a waiver for is that school districts complete child development health screenings within 30 days of enrollment. We recognize that that may not be feasible for the upcoming school year, so once again recommending a waiver there. And finally, under preschool, our state board regulations provides for all stars level certification for preschool programs throughout the state. To receive an all-stars certification and renewal, however, requires certain steps by preschool programs that may involve in-person appearance and not be feasible given the spread of COVID-19 in various communities. So therefore, a waiver is recommended and anticipated. That same waiver was granted for the last school year by the State Board of Education. And finally, it did not make it onto the slides before you, but we also anticipate that the State Board will have before it at its August regular meeting an emergency administrative regulation that allows 30 minutes of instructional time throughout the school day to be used for cleaning, sanitization, temperature checks, and instruction to students on the use of masks and social distancing. We heard overwhelming from our education partners, from our teachers, that school will look very differently when we come back at the beginning of the school year. And we at the State Department certainly recognize that. There's going to be an amount of time that must be devoted throughout the school day for instruction on the use of masks and social distancing, whether it's in the classrooms, in the hallways, or on the buses, taking student temperatures, sanitizing surfaces such as desks, doorknobs, and performing other cleaning that is necessary to mitigate and reduce the risk of the spread of COVID-19 as much as possible. So we will be recommending an emergency administrative regulation to the State Board at its next meeting to provide that 30 minutes of additional flexibility in the school day. Commissioner, I'll pause there.
All right. Todd, thank you. Also, thank the Lieutenant Governor. The process that we use, as outlined in the Governor's emergency order for some of these waivers, is that a memo is issued by the Commissioner. It's signed off on by the Cabinet Secretary, and the Cabinet Secretary is also our Lieutenant Governor. So that's how that process has worked. In addition to the process the state board uses for waivers and emergency regulation. So we have several tools in our toolbox for flexibility and waivers. I fully believe we will continue to use, and there will be need as we go on through the school year for additional flexibility and potential waivers. And I know I've already started having conversations with Dr. Glass, the incoming permanent commissioner of education, and he will continue getting advice and counsel from the various advisory groups that we have, including the Education Continuation Task Force. So this will not end up being the exhaustive list. I predict there will be more waivers probably coming forward for flexibility. There may be issues we encounter due to COVID we don't even know exist yet. We're going to try to have the next presentation finish up by 3:30 because we want to have a full 30 minutes for questions. And the next topic is over the concept involving the concept of daily participation in non-traditional instruction. David Cook, please take it away.
Thank you, Commissioner, and I will do my best to be done by 3:30. Go ahead and go to the next slide, please, Melody. I'm going to go through a couple of different topics fairly quickly. The one is regarding the way that you're going to be determining that a student is involved in instruction. You all, teachers, have obviously for forever and ever recorded attendance. And because of the different things that Todd just alluded to, we will not be recording attendance in the 2021 school year. In place of that, all students will be measured as being participating in the Infinite Campus system, and that's how we will measure that they are there, if you will, or that we can see them for those kids that will be learning remotely. It doesn't mean for those students that you have in person in school that you won't be collecting attendance, because there are safety issues there, but you won't be, that information will not be submitted up to KDE. Only daily participation will be recorded and submitted to KDE. Next slide, please. So daily participation, which is the term we're talking about, it's what's listed in the emergency regulation that Todd mentioned, is a measurement of the interaction between students and teachers. Those interactions will be recorded regardless of whether the student is in person or is learning remotely. For participation purposes, it's about the engagement between the teacher and the student. It's not about quality of student work. That's what grades are for. We're going to be recording participation for every day in the instructional calendar for every student. So keep that in mind. Next slide, please. Definitionally, and this has been a little bit of a source of confusion, I think, among folks. The emergency regulation defines non-traditional instruction as remote instruction in which student is learning at a location other than the traditional classroom using digital or other alternative methods of learning. In this regard, and because of this definition, we sort of have a two-pronged definition of NTI. We referred to earlier unlimited NTI days. That is a function of an actual statute that's part of the school calendar law, which refers to an actual closure of school for purposes like COVID or weather or other health and safety situations. So that's a situation where nobody is at school in person. The school is closed to in-person classes. But we also think of non-traditional instruction as the different things that you all are thinking about doing in terms of hybrids and virtual models. Those are technically non-traditional instruction as well. But you'll hear us say NTI days. That's when we're talking about that full closure of the brick and mortar building to in-person classes. Next slide, please. So as I just mentioned, we have NTI days, and then we have other types of non-traditional instruction. So we talk often about NTI days. That is the program that each one of the districts in the state has an approved plan for. It's what you used in the spring when you were closed to in-person classes for the last 8 or 9 weeks of the school year. And you will have possibly those kinds of days this fall too, but you will have other situations where you're doing learning outside of the school building that we refer to under the regulation as non-traditional instruction. Next slide.
David, just go ahead through and Melody will catch up with you.
Yeah, what those slides are saying is they're reminding us of the various kinds of non-traditional instruction you might encounter in your school district this year. The first is a full-time virtual student, and that is a student who is signing up for a full-time virtual environment, which could be, and in most cases when we say full-time virtual, we're talking about a student that's sort of moving themselves or separating themselves out from their traditional classroom situation and will be instructed by teachers that are not their normal classes teachers. That's a virtual academy. Could be a virtual academy that's a school within a school, but it could also be a separate academy that's a district-wide kind of situation. So that's a full-time virtual student. The second model could be a school-based full-time virtual student, which would be a situation where you've got some of your kids who are virtual, but they're using and being instructed by the same teachers that would be their normal schedule. They just happen to be at home instead of at school receiving that instruction. We also have those blended hybrid models that the Lieutenant Governor talked about, which are AB models, half the kids Monday, Wednesday, half the kids Tuesday, Thursday. Everybody on Friday is in an Nti day because they're virtual. There we go. Right on time. Thank you, Melody. And then the other thing I wanted to remind you of is we all believe that there's a very good possibility in this coming up school year that we may have partial district closures or partial school closures where you may have situations where you need to shut, one building may need to go 100% virtual. In that situation, we still wouldn't call that an Nti day because the district is still functioning on a regular student attendance day. But you would still record participation for those kids as being remote learners on that day. So that's the great thing about the participation functionality as opposed to attendance, and coupling that with funding is it allows us to move very seamlessly, and especially thankfully because Infinite Campus has developed some really great functionality moving forward called blended learning groups that allows us to very seamlessly move between virtual and in-person instruction. Just a reminder for folks who are involved in this part of the process, for this year only, we are sort of suspending Nti because of the way it functioned in the past. Was not something you recorded in your calendar on the front end of the school year. It was always after the fact. So it snowed, for a couple of days, and you had Nti days, and then you on the end you told us about that. We are allowing folks to incorporate Nti days into the calendar that's submitted due next week. So if you are doing a hybrid model that has a Friday that everybody's virtual, then you could put that in your calendar as an Nti day. So there's not that need to wait until later on for your end of the year calendar. Next slide. So the types of daily participation very quickly. For a student that's in person, participation basically becomes the substitute for attendance. So for a student that is in front of you, the teacher can see them. The participation is check. They're there. They're in class. Next slide. For the kids that are not in person, they're learning remotely in whatever model that you're using. The regulation specifically labels 4 ways that you can count participation for those students. You could count it by the virtue of a one-on-one video communication or phone call for those who don't have digital access between a teacher and a student, or between the teacher and a parent if the student is a young student or a student with disabilities. Those situations also count. It could be a group video communication or phone call with a teacher and a group of students or an entire class. in which there is an interaction there. It could be the amount of time or time logged by a student in a learning management system when they're doing digital work at home, or it could be the submission of a paper-based assignment packet or assignments by students who are in a non-digital, non-traditional setting. Important thing I will note here is that while there's a requirement for daily participation to be recorded in Infinite Campus, because of situations like the last one I just mentioned, where you might collect a packet from a student on a Friday, you can you can go into IC and put those daily participation checks after the fact. So if you get the packet on Friday, you could go back and go, okay, I'm going to give student A a check for daily participation for Monday, Tuesday, Wednesday, Thursday, and Friday. You don't have to enter it every day, but you have to have an entry for every day, if that makes sense. Recording daily participation in IC very quickly. This is more for folks who deal with IC. We're trying to make sure everybody as much as they can uses the blended learning functionality that's just been added to Infinite Campus. It's a whole lot easier than setting things up as virtual performance-based classes, because those classes would then require us to record daily participation outside IC in some other fashion, so you could include those students in that participation rate, because a virtual performance-based class in IC only gets participation counted at the end of the year, so that those kids would not be in the number, and you would need to collect that information outside Infinite Campus. Next slide. I think the next slide might be the last one. I hope it. Yeah, there it is. Real quickly, how this is going to work is you're going to input that information, and then at the district level, KDE 3 times this next school year is going to pull that data for daily participation rates, for district level rates. That's how we're going to report it. That will be in October of 2020, in January of 2021, and in July of 2021. That information will be pulled from IC. It will be shared through the KDE communications methods, our website, social media, and it will be shared with the Legislative Research Commission, the legislature, so they have information about how participation is going for students this year in lieu of the attendance figures. I did it, Kevin. I think that's my last slide.
You did it. You were actually a minute early. So thank you, David. Very good information. We want to now move to the question and answers. We want to devote the last half hour, a quarter of our time to question and answers. As I mentioned earlier, we did have the Go Soapbox and the Google form set up yesterday. And because of that, we have over 250, maybe almost 300 questions now. And so there's no way we can answer that many questions even if we devoted the whole 2 hours to just questions. So we're going to take the questions that we're able to rank the questions based on the same questions that are kind of getting the same number of level of interest. So the ones that are the most popular that relate to the topics today. We also know you're asking questions that may have to do with a local decision, and we know these are good questions. It's just not appropriate for us to answer. For example, I saw a question last night. It's a great question. Is it okay for me to wear scrubs to work at a school, because scrubs are easier to clean and disinfect than something else you may wear to school, a button down and slacks. So that's a great question, but that's a question that needs to be addressed at the local level, and I'm sure they will address that for you. So we will not be addressing those questions. Questions we don't get to today that are related to these topics covered and state level topics, we are going to populate the Q&A document that we have in existence. We call it the yellow sheet. It's posted online. It is updated daily. We have around 500 questions and answers in there now, and we will add these to them as well. Many of the questions today probably are already answered in that Q&A document. That's okay too. So Karen, please start with the questions. And we have our experts from public health with us, as well as relevant KDE staff available to answer.
Right, and Kevin, I'll just add to that that FAQ page that we'll be adding this to is on the page that Kelly Foster already shared with us. So under the reopening guidance, just below that is where you'll find it. And this presentation will also be available on our media portal, which is at mediaportal.education.ky.gov. So if you're looking for this information later, you can find it there, or simply go to our website and do a search on media portal, and it'll be our featured post out there. All right, so the next question, this is going to jump around a little bit, so I need our KDE folks to be on their toes as well. How is paid leave granted if a staff member contracts COVID-19 or if they need to care for a family member with COVID-19? This may be Robin or Kay Kennedy.
This is Kay. So the leave options were described, I think, in a document that we put out maybe Monday of this week, I believe, the leave options. So, you have emergency leave now is unlimited. That can be paid leave. You also have your sick days, and there are provisions from the CARES Act that also provide for either paid leave or extended FMLA that can be utilized if you have a family member who is ill with coronavirus. So we have a nice chart out on those documents that Dr. Foster showed earlier. So I think there are certainly options that are available that you need to work with your HR folks back at the district office to determine which one of those is the best avenue for you in a particular situation.
Thank you, Kay.
We also have a flow chart that Todd Allen, our legal team, issued a flow chart this week on leave that went to superintendents and I think to board council, in addition to what Kay described. So
yes, it's also posted. Yeah, it's posted out there at the same location. So yeah.
Yep. Thank you.
I'll jump in quickly
How will
as well.
Schools across? Go ahead.
Sorry, go ahead. Go ahead, Karen. It's fine.
Okay. How will schools across the Commonwealth be monitored to ensure healthy at school guidelines are being followed consistently and with fidelity?
Well,
I'm not
first of
sure
all,
that we're going to be doing that kind of monitoring.
The department will not be, we're not going to have the mask police. We're not going to have the social distancing police. But what we do is we have a relationship with each district, and we ask everyone to act in good faith. And good faith means that we're going to try our best to abide by the expectations issued in that flagship document and then all the other guidance documents, knowing there will be times that Kevin takes his mask off, knowing there will be times that social distancing is not perfect. And but we're going to act in good faith as a school community. And the monitoring will be, will be self-monitoring in that, we have levels of administration. We have a local board of education. We have parental involvement on SBDM councils. And in addition, I hate to say this, but if cases start going up or if there are cases in schools and that is tracked back to not following the guidance and expectations in good faith, that should be self-policing.
All right, I believe this next one is going to be for Associate Commissioner Greta Hilton. For those that will be evaluating for special education services, will there be more guidance documents to make evaluations as complete as possible? For example, how to determine things like adverse impact through virtual platforms.
Thank you, Karen. As we move forward in the Office of Special Education and Early Learning, we're actually planning to continue the series of short webcasts that we offered last semester. That was really the topical bursts of information. And we're currently taking suggestions for those, so we will certainly take this as a suggestion for how to make eligibility determinations. One of the things in this, I'm going to say a couple of things that may answer several of the special education related questions. It's important to note that IDEA in and of itself has not changed. The requirements were not changed, and the entitlement to FAPE is still the same. The Secretary chose not to seek additional flexibilities from Congress, and since this is an act, it would take an act of Congress to make changes. We, however, as a state and states across the nation, are looking for all the flexibilities that are allowed under the Act and under the Kentucky administrative regulations to ease some of the burden on schools and districts. But at the end of the day, it's extremely important to continue working through IEP teams or admissions and release committees, ARCs in Kentucky, to ensure that all students with disabilities are provided a free, appropriate public education and IEPs are being implemented as written, while also working with public health departments to ensure that safety of staff and students and families are paramount. And so fate may look a little different, and that's okay. But we can work with districts on individual basis as needed to work through some of those things.
Thank you, Greta. What can schools expect as far as money to help with all the requirements that will be imposed on them? We'll go back to Kay Kennedy, I believe, for this one.
Hey, Karen, this is Robin. I'll be happy to take that question.
Thank you, Robin.
Yeah, so we've already talked in the presentation today about the flexibility to try to give a little bit of certainty or predictability to funds that will be coming to local school districts to help them with the coronavirus pandemic and all the other things that school districts are faced to pay with. The other things that are available, the CARES Act also provides funds to local school districts under ESSER and GEAR, which are two pots of money. One has broad flexibility for our local school districts on how they can spend it. They can expend it for those types of things related to their federal title programs that they're already very familiar with. And they can also use it for those PPE products that are needed, whether that's disinfectant, things to do hand sanitizing, tape for your floors so you can practice that social distancing, masks, all those gloves, all those things that school districts will need. So that's available for them as well. And then GEAR, we also know that lots of school districts are trying to really hard to make improvements in their remote learning. And so dollars are also permitted for that remote learning technology, purchase of devices for their students, and then all kinds of professional development. Again, large flexibility. And lastly, we don't want to forget about the requirement for nutrition for our students. Very, very important. Kids have to have that good nutrition so they can learn. And so dollars from the CARES Act can also be used to support our food and nutrition for our students. So it'll be really important for your districts as they work together on how they prioritize things. We encourage that community involvement and the support and voices of you as teachers and other central office and building level supervisors to talk with your superintendent and your local school board on the needs for your particular district. So every district has unique needs, and we want them to make the decisions on what's best for their district.
And I would just add to that, Robin, that I would just add to that it's important that we continue to reach our members of Congress, reach out to them to make sure that they know that we continue to need an additional round, at least an additional round of additional CARES funding. I know that's being talked about right now in Congress. We know that you don't have adequate funds right now in a normal school year to provide Kleenex and sanitizer, et cetera, and we have to ask parents to bring that in. And we hope that the CARES Act funding that Robin described will eliminate that requirement this year, but we also know there are going to be expenses that we don't even know about yet related to COVID-19. And so it's important that our members of Congress understand the needs that are there, whether we're in person or not in person school. There are needs there, an extra amount of money that will be needed. And we also heard the governor say yesterday, this next budget or the budget we're in right now is going to be very difficult because of the revenue decrease that we've seen just due to the COVID economic fallout.
And let me also add, Commissioner Brown, I have written to every single state in the country, to their top education official, asking them to join me in requesting an additional round of CARES funding for our state budget. knowing that the largest portion of our state budget goes to public education. In that request, I also asked for flexibility because if your district has more students in person, you may need additional dollars for transportation or PPE, whereas if you're digital, you may need dollars to be spent on technology and broadband. And so I have all of those top officials joining me. I've sent that letter to our Kentucky delegation, so every congressman we have and both of our U.S. senators, and I sent it to the U.S. Department of Education Secretary Betsy DeVos. And so it's my hope that nationally we can make a push for every student, not just for funding, but for flexibility at the school level.
Right. Thank you all. Our next question, I believe this will be for Dr. White or Dr. Meserly. As I understand it, masks can only be off if social distancing can be achieved, but students who are not socially distanced will need to have masks off to eat in their classrooms. Can you clarify what is expected here?
Well, I think I think that the expectation is when students are eating, they will be 6 feet apart. Whether they're in their classroom, whether they go to a cafeteria, whether they go to a gymnasium where those seats have been marked off. My understanding and my expectation is that they will be 6 feet apart when they're taking those masks down.
Okay. What are the required steps when a teacher or student tests positive for COVID-19? Contact tracing will be difficult at the high school level.
Well, so when there is a positive COVID-19 test, laboratories notify the Department for Public Health and the county where that person lives. So as soon as we're notified of that positive laboratory test, then the positive patient will be notified, the positive person will be notified that they are positive. They may already know that from their clinician if they got it done at their provider's office. And then that information will be gleaned from them. Where have they been? Who have they, we're talking a teacher or faculty member now, what classes have they taught? How far away were they from the students? Were there any students that they spent more time with than others? Were there any students that abused the mask recommendations? Were they in a classroom where they had to be closer than the 6 feet? How long a period of time? All of those kinds of information, as well as did they go to the grocery store? Did they go to their bunco? Did they go to a family reunion? Did they attend a wedding? In all of those situations, how close together were they to others? And did they wear a mask? And did others wear a mask? All of those factors will be involved to determine if people that teacher was around are low risk for exposure. Therefore, we don't need to do anything but move on to the people that are high risk. One thing that I was on a different call earlier today with the Fayette County Board of Education, and the question was, what do we do? Are the health departments prepared to do this? It's a very good question. We know that the workforce in the public health has been lowered, and we use the word slashed for decades. And we have some health departments that have a staff of 5. So we at the state have been able to, with funding, to hire 800 contact tracers across the state. They're not all sitting here in Frankfort. We've got them out across the state. So if a county such as Bell County, who went from having 9 positive cases to, I believe they're up to 70 now, that obviously would overwhelm their workforce. So we are able to bring in these teams of contact tracers to help bring them up to speed. And those people can then move around through the state. And if it gets to a point where a health department is overwhelmed to the point that normally they would call me and say, okay, Connie, you're positive. Let's talk about this. Where have you been? Who have you talked to? Then the contact tracer would call those people that I was in contact with and tell them that they were high risk and need to be in quarantine and go over that with them. In a crisis practice care situation, they would call me and say, Connie, okay, who have you been in contact with? Let's go over that. Yes, Mary is a high risk, but George and Roger and Fred aren't. you need to call Mary and tell her she needs to self-quarantine. And I, as the positive patient, would need to contact those folks. Right now, we're not to crisis care yet. If the case load continues to go up, that may happen. But that is all the responsibility of the health departments to do the contact tracing. The responsibility of the schools, as I think I said earlier, is keep those manifests, because you're not going to remember what you did 3 days ago, 5 days ago, 10 days ago, yesterday for me. So having those manifests, so when someone comes in and says, little Connie is positive, and we need to know what was your contact with little Connie, you can look at that seating chart, or you can look at that bus chart, and you can know your contact with little Connie, and then that way you and the contact tracer can come up with who's at high risk and who's at low risk.
Great. This next one, I know that I've heard it answered before, but I don't think we've done it on this call yet. And it's been asked several times. How does the temperature check guideline protect others when many positive cases don't present with a fever as high as 100.5 or above?
And that's a really good question. Many of them don't, but many of them do. And so I think we lose sight of that. As Dr. Stack said earlier, those are easy ones. We can catch those folks. And if we can catch them before they walk in the building, I have a friend who's a dentist, and patient walked in the room, wasn't 5 steps into the room, took a temperature, and it was 102. Person turned around and walked out. She then chose to deep clean that whole office. And now they've started checking temperatures before you walk into the room, before you walk into the building. So had that temperature been checked before they walked into the building, they would have just asked that person to go home and would not have to have gone through that whole deep cleaning activity. I'd like to give you real quickly a story, and this is about hairdressers. And if we've got teachers on the line, we've got a lot of people. As you can tell, I haven't been to my hairdresser in a while, but there were 2 hairdressers in Missouri that both turned out to be COVID positive, and contact tracing found that they had cut the hair of 159 different clients. And we in public health threw up our hands and said, holy moly, this is just going to be a big old hot mess. Well, it turned out that the 2 hairdressers wore masks all the time. They required every one of their customers to wear a mask all the time. Of those 159 customers, nobody got COVID-19. Because they did the right things. And you're when you have your hair done, you're up close to someone cutting your hair, washing your hair, whatever they do to your hair. So I thought that, and the CDC even published this because it was a perfect example of following the public health guidelines. That mask prevented 159 people from being exposed.
That's a great example. Thanks for sharing that. This may be for our staff. I'm not sure. What should staff do if they feel like they are in an unsafe environment? Do we have anyone that can answer that one?
I think that is a KDE question.
Yeah.
Well, the first thing you need to do is talk to your immediate supervisor. You need to assume you're saying if you felt you were in an unsafe environment due to COVID or due to the expectations not being followed. You need to have that conversation with your building leader. And then there may be issues that the SBDM need to be made aware of and to address it that way. Kelly Foster, Dr. Foster, do you have any follow-up? You're a former principal.
No, I was thinking the same thing. The first step would be to talk with your immediate supervisor, your building level principal. And if for some reason you don't feel like that's moving anywhere, then obviously central office staff, local school board members. And if it's more about, health issues, I would also talk with your local public health department.
Okay. Let's see. This next one, I think Dr. Stack had already addressed. Are there going to be extra steps or precautions to help protect teachers who are at high risk for the coronavirus?
Well, I think, Dr. Meserly, masks and social distancing and hygiene, that's going to protect all of us. Uh,
I think, so we've been on lots of calls with superintendents, and they've asked these questions about having staff members who may have a chronic condition or perhaps can't wear a mask at work. And that has to be a conversation between that staff member and their principal, their district level, on their medical needs and how those needs can be accommodated in the school setting.
And if you get a positive result from a COVID test, how long do you have to be in quarantine before you can get retested?
Well, that's a very good question. And in Kentucky, since the very beginning, there are two different ways, and the verbiage is there's isolation, there's quarantine. And I got that all mixed up at first too. So I finally figured out I get isolated. It starts with an I. I've done this, that's my whole educational career. So I get isolated and my contacts get quarantined. So my contacts need to stay in their quarantine setting for 14 days. Because once they're exposed to me, it takes up to 14 days at the most for a person to begin a COVID infection. Usually it starts quicker than that, but 14 days is the comfort level for preventing spread. On the other hand, for me, from when I was diagnosed and started having symptoms, I have to go 10 days with no symptoms, whatever symptom I started the disease with, or any other COVID symptoms, and you can just Google COVID symptoms plus CDC, and that list will come up for you. It does change, and it has changed over the last few months. I have to go 10 days with no symptoms, and the newest guidance and 24 hours with no fever, which to me is a symptom. But I can't have a fever for 24 hours and no other COVID symptoms. Then I can be released from isolation, and you would do that in contact with your local health department.
Great, thank you. Will teachers be required to take a COVID test before returning to school? I don't believe they will, unless somebody wants to correct me on that.
We felt that way at the Department for Public Health. We don't have enough tests to do that, and there's two ways you can return to work. One is the 10 days without symptoms. The other is getting a negative test. And what we're finding is some people are going weeks with little fragments of viral particles still present in their system. They're not still infectious. We had some poor guy in Western Kentucky that was an emergency room physician. After 45 days, they called us and said, how much longer do we need to keep testing this guy? And I said, for goodness sakes, quit swabbing that guy's nose and let him go back to work. Because what they've found is they've tried to take those people that have swabs that are positive for a long period of time, they've tried to take those swabs and grow the virus in the laboratory, and they've not been able to. So we don't feel people that go longer than that are infectious. So you don't really need to be retested if you follow the non-testing strategy for return to work.
Okay. For students and staff, are screening questions for the symptoms, all the other symptoms, is that required to be asked upon arrival, or temperature check only?
I can answer this one. This is Dr. Meserly, and I'm a former school nurse, for those of you who didn't know that. So I would, I've had this question from school nurses and district health coordinators. Asking all those questions at school entry is not really feasible. The temperature is the most important. A lot of schools are sending home education to parents about what the signs of illness are and when to keep your child home if they have any of the symptoms of COVID. Some school districts are having parents sign an assurance or a form that says, I will not send my child to school or place them on the bus if they have A, B, C, D, E symptoms. So those are examples of some of the things that districts are doing, but we do understand that something besides just taking a temperature, asking all those questions at school entry may not be feasible.
If a staff member qualifies for the Families First Coronavirus Relief Act, will the district continue to pay their portion of insurance, or will this cost be passed on to the staff members as in traditional FMLA? This is probably for Robin.
I can jump in and take that, Karen.
Okay, thanks, Todd.
While I am an attorney for the department, I can't provide legal advice, but I can provide you with information. The U.S. Department of Labor has a great website with questions and answers regarding the Families First Coronavirus Response Act, and this is actually answered on their website. They indicate that the employer, the school district, would continue making normal contributions to those types of benefits. So the employee would continue to pay their portion as if they were continuing to work, and the employer would continue making their contributions during that period of time. So if you have further questions about the Families First Coronavirus Response Act, I do encourage you to go to the U.S. Department of Labor's website and check out that question and answer document, because it is quite detailed and has a lot of very useful information.
Thank you, Todd.
Karen, let's do one more
Would you
question,
please?
and then we're going to have Lieutenant Governor close us out. And we have a hard stop at 4, as we know the governor will be having a press conference today. So let's see if we can squeeze in 1 or 2 more questions.
All right. Would you please provide clarification on classroom doors? Do they have to be locked and shut, or can teachers leave them open to facilitate more air circulation?
We have, at the Department of Public Health, had a grant where we got the Eastern Kentucky University has done a training on ventilation at their College of Public Health. We are inviting local health department environmentalists and folks from the Department of Education are taking this training, and we're learning different ways that we can improve ventilation, but also stay in not only the safety standards of the Department of Education, but we also had the state fire marshal on meeting with us this morning at our 10 o'clock meeting. So all of those things will be spelled out as to when you can open doors and when you can't, for improving the ventilation, but also for staff and student safety.
Okay, I've got one more that I think Greta might be able to answer if we can do this one last one, Kevin.
Okay, let's do it.
If schools are using 100% virtual instruction, can staff and families sign a permission form to allow home visits? If not, how will schools serve students with severe needs, no internet or devices, such as English learners and others with individualized need?
I'm going to defer that to Dr. White or Dr. Meserly, because I think there's a component in there for public health to answer. But I think one of the things that I will jump in and say from the special education lens is if there are, and there very well may be, services that districts cannot provide through a virtual model, such as orientation and mobility services that need to be face-to-face. And should that occur from the special education perspective, we would recommend that IEP teams convene and the district issue a prior written notice to the families to explain that, this is the option that we're believing that the student should be able to be provided, but we're unable to do that. And then on the back end, when we get through this and we reconvene in face-to-face, then provide those service minutes through compensatory education. Dr. White, Dr. Meserly, would you like to weigh in?
I know our HANDS team are working on, that's our biggest home visitation program we have in the Department of Public Health. And unless something's changed this week, we are not doing in-home visitation at this time. We're still working on virtual. We're trying to figure out a way to make that safe for the recipients as well as for staff. So I would agree with you.
Thank you.
All right. Thank you all. Kevin?
Thank everyone for the questions and for your participation. As we indicated earlier, we are going to take the questions we were unable to answer that are relating to these state level topics and populate the Q&A document that already exists on the KDE COVID-19 website. We will communicate to your membership groups when that is available, and we will also try to just break those out so you know where those begin and end in that document, since there's other questions and answers in that document. I will now defer to the Lieutenant Governor, and she's going to close us out.
Well, thank you, and I want to thank DPH and KDE again for all of the hard work that they've done, and I would be remiss if I did not also thank KEA for helping set up today's town hall. They've always done a wonderful job representing our teaching workforce. I'm a member myself, so I really appreciate the advocacy that they provide for us. So let me just say this again. at the heart of every school reopening plan should be the health and safety of every child, every adult in the building, and all of the families that they go home to at night. We all truly believe that. That's going to look different in different places. My hope is that you have a voice in your school district's plan. All of our teachers, the parents and kids involved should have a voice in that plan, and you should be treated as the valuable commodity that you are. So I hope today has been helpful to clear up any misconceptions that are out there. No school is coming up very closely, closer for some of you than others. But as someone who was a teacher myself, my husband is still a teacher. We have one student in high school and one going into college and a 5-month-old at home. So I want you to know that the same anxieties that you feel, I feel, because my family is your family. And so we continue to make these decisions with that in mind. We will continue to monitor the data and make the best decisions possible in really, really uncertain, unfortunate circumstances. So thank you again to the education community, the public health community. Thank you for coming together. Stay with us. Stay on Team Kentucky, and we will get through this together.